I think that every single lawmaker who voted for it, the governor, if he signs it, will have blood on their hands. What it would do would strip trans young people in Arkansas of vital health care. So things that people rely on to minimize very extreme distress, hormones, puberty delaying treatment, and it would even bar physicians and other clinicians from referring for this treatment. And so we have to understand that this is care that is approved and supported by every major medical association in the United States. It's been used to support and affirm trans young people for decades.
This legislation would allow policymakers rather than pediatricians to determine the best course of care for our patients. Evidence-based medical care for transgender and gender-diverse children is complex. As pediatricians, we know how to take care of our patients, but under this bill, doctors and medical professionals would be penalized for doing so, or for even referring patients for gender-affirming care. Politics plays no part in these discussions. It is therefore unfortunate and dangerous that this bill has politicized medical care, and that the people most likely to suffer as a result, transgender children and teens, are not consulted or prioritized.
We've already heard from physicians in Arkansas that just the introduction of the bill and the debate over the bill has led to an increase in ER visits by trans young people who are experiencing mental health crises. So there's the human toll that will be felt immediately. There will be the economic toll. The ACLU is preparing to file a lawsuit. These lawsuits are expensive. That will be on the taxpayer's dime.
There have been a plethora of bills introduced in state legislatures all over the country targeting children, targeting transgender children. I encourage us to look at this in the context of years-long attempts to stigmatize and further marginalize trans people and have that stigma codified into law. This is not new. We've seen bathroom bills, we've seen other bills in previous years.
So what we really need to do is show this community that we have a national movement behind them, and we're not going to stop until the governor vetoes the bill. And if he doesn't veto the bill, then we're not going to stop until we're successful in court. And in the meantime, we're going to do everything we can to send messages of love and support, as well as resources to trans people in Arkansas who we know are hurting so much right now.
Can we just remember that these are human beings, that they're people, and that any decisions about the healthcare of trans youth should be made between that transgender young person, their parent, and their doctor. The government has no place in these decisions.